Hi, my name is Joan Kwamboka, and I'm a research analyst and project manager at the Center for Health Information and Research. Today, I'm excited to present to you the work that my team and I are doing on the State Opioid Response Project. So the title of my poster is Pathways to Addiction, a Model for Opioid Resource Allocation. Now, we're aware that the US is in the middle of a dual epidemic, COVID-19 and the opioid epidemic. The US accounts for 80% of the global US opioid consumption, and 2 people died from opioid-related overdoses in Arizona. 4 out of 5 of those heroin users started by misusing prescriptions. Now, we know that interventions are effective, but the problem is optimizing the implementation of opioid interventions is complex given the social demographics. Now, our objective was to simulate the effects of interventions to lower prescription opioid misuse by naloxone, opioid prescribing, and the time spent in treatment. In our methodology, we had a 4-pronged approach. We read the literature to understand the problem and identify the data sources, and then we modeled the design and then implemented it in a software package and then did our calibration. So we identified 4 important states: susceptible, exposed, addicted, and those in remission. And the diagram shows the different states and how it was implemented in the software package. And then we added what we put in our inputs, the different compartments and the input data sources. And in our results outputs, we've put 2 that were really interesting and important. For instance, we saw that if you only provided naloxone, you saw that the addicted population increased. The overdoses, yes, did decrease, but the number of people in opioid addiction state increased. Now, in our conclusion, we saw that multiple interventions are needed to curb the opioid problem. You cannot just rely on one intervention alone. If you need to read more into this, we've provided a QR code with extensive references that we use to build the model and the references that are in this poster. And if you have any questions, we've also included our email. Please email us and we'll be happy to talk to you. Thank you.